Let's talk about swollen eyelid, or you may say orbital cellulitis. If you have a swollen eyelid that is warm, painful, and eyeball is red. Perhaps your vision seems off, like your vision is blurry, double, or maybe color halos in one or in both eye. When you look at the mirror, you may notice that one of your pupil is larger than others, or your eye may hurt when you try to look left, right, or up and down. And the swollen eye look like it's almost bulging forward, like it gonna pop out. Or maybe you have a fever with all of these symptoms. Your doctor will seriously look for. If you have these symptoms, then it is known as orbital cellulitis. An orbital cellulitis is when you have an infection that gets behind a thin layer of tissue surround the eye called septum. This type of infection is pretty emergent because it's usually aggressive. It can lead to vision loss, and it can even spread behind and get to the cavernous sinus. So, if you think you have these symptoms, then definitely contact your eye doctor. But sometimes if you have a swollen eyelid that is red, a little warm and tender, but it doesn't have any of the neurological problems, like the eye muscles aren't painful when you're looking left and right. Or there's no restriction and you don't have like ptosis, where the eye bulging outward, fever, etc., then after times it can just be a preceptil. Treatment. Cellulitis, where the infection hasn't gotten behind the septum yet, but still in these cases, to treat that infection before it potentially gets worse. So your doctor often prescribe pretty strong oral antibiotics, or sometimes in conjunction with topical antibiotic, to help that resolve as quickly as possible.